Welcome to Theory of Pets. I'm a passionate pet owner with a drive to help others like me uncover the truth about the pet industry and what goes on behind the scenes.
Hi there, everyone. I'm Connor Knight with Top Dog Tips. Thanks for joining us today. We have Dr. Lyndsey Kingsley back here again today. And if this is the first time you've heard of her, she was on our podcast before on talking about summertime heat and the other stuff that you should really take into consideration with trying to make sure they're cool, or the pests and different things that you need to take into consideration with like hot pavement, stuff like that. If you haven't listened to it, go back and check it. It's episode 125. Today, we're going to be talking about the misunderstood topic, vaccinations with dogs. I think a lot of pet owners are going to be really excited about this one. I myself have been doing a little bit of research about vaccinations, and there's this whole group out there that is either completely against vaccines or they're aware of like over-vaccination. So thanks for joining me today, Dr. Kingsley. Hopefully you can clear some of this confusion up and give us some insight on what to do going forward.
Yeah, thanks for having me. I'm really excited about this talk.
Cool. So to start off, I guess we'll talk about vaccinations. Just to start off, like how did vaccines come about? Like, do you know exactly when the first vaccine or the first couple vaccines came about, and like why it ended up happening the way it did?
Yeah, so vaccines got started. I forget where it was, but in humans, smallpox was a really big deal. Mm-hmm. And so somebody had the bright idea to there's cowpox, which was endemic in animal population, mm-hmm. and actually inoculate themselves with cowpox by just, taking scabs off of the same lesions. And they found out that small cowpox would help prevent smallpox. So that's where the word vaccine is actually vaca, which is cow. And so that's kind of where it got started. And as time went on, the value of a vaccine and preventing disease, both in people and then kind of extrapolating it into animals, just really has been a game changer. And right now, it's really interesting because vaccines have been in the media so much. It's really in vogue. And I think a lot of people's radar has been turned on. Vaccines in veterinary medicine, it used to just be all those little letters that showed up on an invoice. Then your animal got poked however many times a year, whatever your vet said, yeah, sure, whatever. And now I think people are paying a lot more attention to it based on what we've had to go through as a population.
Okay. And so to start off, I guess, after the cowpox, like when did veterinarians start, I guess, coming up with vaccines for dogs, and cats?
I don't have a specific timeline, but I know, 70s, 80s, and the development of vaccines is very dynamic. It's changing all of the time. And the vaccines that we used, in the 70s, 80s, they are now completely different from where we are now, from a safety standpoint, from an efficacy standpoint, from how long they last. Just like vaccines in people, we've seen all of these different versions that have different protocols. It's the same thing for veterinary medicine. One drawback is we don't necessarily have the funding and the numbers to do some of the research. So, mm-hmm. And that'll kind of come into some of as we get deeper into this conversation, how it's all been affected and how things are shifting with recommendations.
Okay. So why should people get their dogs vaccinated? What is the importance of that?
So that's a great basic question. So for one, just the welfare of the animal. The diseases that we're vaccinating against are pretty devastating. Most of them can end up in death, or cause permanent damage to your animal. So even if they recover on it on their own, they're going to have lifetime consequences from that disease. Also, from a public health standpoint, rabies is, there's so many of these kind of big, scary, sexy diseases like Ebola, and everybody thinks about that. But rabies is actually the only 100% fatal virus in people if left untreated. So it's got some pretty scary numbers. And how we get rabies is typically from wildlife or domestic animals. So rabies vaccinations have been so important in controlling such a scary disease from a public health standpoint. And looking at our developed country versus undeveloped countries and how our vaccine protocols for different diseases vary, it's such a stark comparison.
Okay. So rabies vaccine for dogs has been super helpful just for the pet ownership, like whole spectrum, basically in the United States, and I guess all around the world. Now, I guess were there any vaccines that you would say didn't work or were recalled here recently? What about those kind of vaccines? Were there any of those?
Yeah. So just with anything, as time goes on, you realize the immediate consequences, and then you realize the long-term consequences, and then you go from these clinical studies, which are usually pretty limited in numbers, release it into the public, and then all of a sudden we have a much larger case study, so to speak, and then we really get a better idea of what the efficacy of that vaccine is. So one big one is feline infectious peritonitis in cats, or FIP. There was a vaccine for that, which we no longer recommend. It was not very effective. Another one is coronavirus in dogs. So for one, it was a pretty self-limiting disease, meaning it would resolve on its own. The clinical signs were relatively mild, and it was a very small window of age that these animals could contract it. So we no longer recommend vaccinating for those. There was a silly Giardia vaccine once upon a time that didn't really prove to be effective. And then right now, one that's not necessarily recalled, it doesn't really lump into this one, but the rattlesnake vaccine is under some pretty strong scrutiny and has some pretty varying opinions on it. But those are the big ones that come to mind.
I think you touched on that one last time we spoke. So what could you refresh my memory, or I guess if people haven't listened to the other one, talk a little bit about that rattlesnake vaccine. Why was that one recalled? Why is there so much, I guess, controversy around that one?
Yeah, and so to be fair, it's not been recalled.
Oh, sorry.
And there's some
I
vets. No. I mean, there's some vets that really swear by it. There's some owners that really swear by it. And then there's some others that can argue that it primes the immune system to the point where if an animal has a rattlesnake vaccine on board, it can actually cause a worse reaction. And so again, the jury's still out on it. But if you think about the case studies that need to happen for some of these vaccines, the only way to really find out is to test it with whatever you're vaccinating for. And we don't really want to subject a population of dogs to rattlesnake bites, because that's just not very nice. But so there's been some argument that in some cases, if we have a dog that's vaccinated and they get bit by a rattlesnake, it doesn't mean that they can just waltz away and not have to worry or have any of the side effects that we get from a rattlesnake bite. It just opens the window a little bit more. So if you have a dog that's out, field trials and hunting, and you're in the middle of nowhere, probably like 4 or 5 hours from their closest emergency clinic, it buys you a little bit more time to get that pet seen. So that's really what it's marketed for. But as we're seeing more and more cases, we're getting a little bit clearer picture of what we're actually doing.
I wanted to actually, when you said that we don't really want to subject an animal population to exposure to certain illnesses to get vaccines. Yeah, I was going to say, oh yeah, that's going to go over real well. We're going to get so much funding for that one.
Right. Yeah. I think that's there's going to have a pretty strong opinion on it. So
yeah, for sure. So, okay.
won't be happy.
So now let's dive into where vaccines start to, I guess, split off into two different groups. One is called core vaccines, and then the other one is called non-core vaccines. Why don't you tell us what core vaccines are and why they're considered core vaccines?
Yeah, so core vaccines are either required by law, which is exclusive to rabies. So because rabies is such an important public health risk, that one is no question. If you have a dog or a cat, legally, it needs to be vaccinated for rabies. Now, there's some little nuance laws and rules that vary by state. And then for dogs, we have distemper and parvo. Those are both very, very manageable. We've had vaccines for distemper and parvo for many, many years. They've proven to be very safe, and they're both very devastating conditions. So both of them, your animal will either pass away from the illness or they will recover. In a lot of cases, they will, as I mentioned before, have long-term repercussions from
like
having
never be
that
the
as
same.
they're younger. Exactly.
Got it.
And the other issue is both of those are viruses and they live in the environment for a very long time and they're incredibly contagious. So if you have a shelter with a distemper break, then that shelter is shut down. No animals can come in or out of it. And then the legwork that has to be done to disinfect that environment, or if you have moving into an apartment and an owner had a dog that had parvo before you, that is a contaminated environment. So we consider those core because they are so preventable, they're so devastating, and they're so hard to control in a population. The other core vaccines for cats is feline distemper. So same thing, it's a different flavor and a specific flavor of distemper that causes a little bit different signs, but still just as contagious, just as difficult to get out of the environment, and still has those same long-term repercussions. So those are what we consider kind of our quote unquote core vaccines for our domestic pets.
So now you said they're required by law. Basically, could you actually go to jail if you don't get those vaccines for your dogs, or would it be just like a pretty heavy-handed slap on the wrist, maybe like a fine?
Well, it really comes down to, and again, it varies by state, it varies by county, but it's more so if there's anything that comes up, your animal bites another person and that animal is positive and you didn't vaccinate him for rabies, you're going to be in big trouble.
Yeah. Got it. Okay. And so just to summarize before we talk about the non-core, so which ones are core for dogs and then which ones are core for cats again?
So we have rabies, which are core for both. And then we have distemper and parvo for dogs. And then we have feline distemper in cats.
Okay. And now, all right. So now let's talk about the non-core vaccines and I guess, and talk a little bit about why. So non-core, I'm assuming just means they're not required. They're still important. Is that correct?
Yeah. Well, so we consider these, the word non-core, it's very kind of sterile and seem just very medical jargon, but I prefer lifestyle vaccines. So essentially we are looking more so, with rabies and distemper and parvo, really well, for rabies, it's required by law. So that's why it's core. But for distemper and parvo, because it's so prevalent and hard to get rid of, the exposure could be anywhere. An animal with any level of just existence, that's why we consider it core. But for lifestyle vaccines, those are more so, does your dog go to a dog park? Do they go boarding? Do they go to doggy daycare? Or, are they a little fluffy dude that lives up in a high rise and doesn't really come into any contact with anything else? Then we're probably not going to vaccinate for Bordetella. Lyme is a big one.
Mm-hmm.
And in Texas, we really don't see it very often. So because we don't see it very often, we don't vaccinate for it. But a dog that's up in the Northeast, up in Boston, they vaccinate for Lyme all the time because it's so prevalent. And we have a few others, but that's essentially, where it's so important to just have a frank, candid discussion with your veterinarian, and really spare no detail on kind of the lifestyle of your pet, and they will help custom tailor what's appropriate, what's not appropriate.
So you mentioned Bordetella and Lyme. Are there any other, or what other non-core vaccines are there?
Yeah, so we have leptospirosis is a big one that we see in Texas, and that's actually a bacterial disease. So bacterial vaccines are a little bit trickier as far as getting long-term protection. So our vaccines for Bordetella, Lyme, lepto, those are ones that will need to be boosted annually because we just can't get quite the level of protection that we can vaccinating against viruses. And then for cats, we have FELV, or feline leukemia virus. So that's one that a cat has to go out and get in a fight with another cat and actually have some sort of bite wound in order for that to be transmitted. So if we have a big fat lazy cat that just vacates one or two house or rooms in your house and he never goes outside and has no interest, probably not going to vaccinate that cat for FELV.
That actually reminds me, my sister, her and her boyfriend, this was back in college at FSU, they had a dog, or sorry, they had a cat named Molly, and it was, I believe it was they rescued it under like a porch or somewhere in Tallahassee, and it actually, I think it ended up getting the leukemia that you were talking about. So it must have been scrapping out there, and that's probably why it got it. Okay, so you mentioned that these non-core vaccines are called lifestyle vaccines. So do you recommend different vaccines for like breed and age as well outside of lifestyle?
Yeah, so breed, not so much. I mean, we will change up our protocol, and our little teeny tiny guys will usually try and break up and not give all vaccines at once. We'll usually stage them out a little bit. But for so that's really the only exclusivity in breed. Age, and we'll kind of get into this a little bit deeper in the conversation, but older dogs that have been repeatedly vaccinated for these same things, we may not want to revaccinate. We may consider doing titer testing instead. Or if you have an old arthritic dog that just goes outside, and goes to the bathroom, comes right back outside, we're probably going to stop vaccinating that kiddo for lepto. And then influenza vaccine, which is flu vaccine, that one's also a lifestyle vaccine for dogs that we usually reserve for dogs that are boarding in an environment that requires it, or if there's a known outbreak of influenza in that particular area.
Got it. Okay. Now, I think what I was going to ask is, are there breeds that are more prone to certain, I guess, illnesses or diseases? If so, what are those breeds?
Well, I think, again, the breeds overlaps a bit with lifestyle. So, if we have field trial dogs and hunting dogs that are spending a ton of time out in the woods, out around wildlife, those dogs are going to be more susceptible to certain things. Dogs that are that go to daycare, or they go to the dog park every day, they're in really high density areas with other animals, they're going to be more at risk. Or if they're dogs that are just super in your face, like the minute they see another dog, they're nose to nose. And those dogs are going to be a little bit higher risk, and we're probably going to be more likely to pick out some of these more lifestyle vaccines and make sure we keep them up to date.
Got it. So like, say, for example, you have a German short hair, because you mentioned hunting, and then you have a Chihuahua. A German short hair may be more prone to Lyme disease, right?
Yep.
Because of ticks, correct?
You got it.
And then Chihuahuas may be less prone to Lyme disease because they're more like apartment dwelling, smaller dogs. I mean, there's some in the city, but they're not going out. They're not hunting dogs. They're not bird dogs. That's for sure.
For sure. Yeah. But I mean, even the Chihuahua, we've got some Chihuahuas that just didn't get the memo that they were, knee high to a grasshopper. They were just, they think they're just as much a German Shepherd or a German Short-haired Pointer. And so if they have, big backyard, or if the family has, property, or if they go camping and they bring that little dude with them, we'll still probably cover them with Lyme just to make sure, because a tick really doesn't take much preference over a German short-haired Pointer versus a Chihuahua. If they happen to cruise by and they have the opportunity, they're gonna
or
go for it.
They both get into a run-in with like a raccoon or something like that, Chihuahua is going to try and square up with it. So rabies would be the best bet for both of those.
Definitely. Yeah.
Okay. So now I guess let's talk about, you said lifestyle, and I believe now that sounds also like the region, kind of what you were hinting on is what you see more in Texas, with, I guess you said snakes. Lyme disease isn't really that big of a deal in Texas, but anyways, region seems to be an important factor because that also ties into lifestyle. So for example, someone in New York that lives in the suburbs, versus someone who lives on a big plot of land in North Carolina. Tell me a little bit about what vaccines are important for, I guess we'll start like on the West Coast of the US. What would you say would be more important there? What kind of vaccines?
Yeah, so West Coast, so still sticking to those core vaccines: rabies, distemper parvo, lepto. The last time I talked to the doctors out in California, and that one is another bacterial one that's we see in standing water. It's transmitted by rodents. So, anywhere there's rodents are everywhere, especially, in densely populated cities. So that one's, we always want to take into consideration. It also causes pretty terrible kidney failure, and it is a zoonotic risk, meaning that if an animal has leptospirosis, a person could potentially contract that as well. So we're not only protecting our pets from lepto, we're protecting our owners, not to be kind of a narrow focus. So lepto would be consideration. Bordetella, if we have dogs that are going into dog parks or boarding, there's some grooming facilities that require it. And that's the other thing is we look at the lifestyle, but we also look at the requirements of whatever place that animal is going to. Same thing for influenza. California, we're probably not doing Lyme. If there's some Cali doctors or West Coast doctors who disagree with me, feel free to chime in. But I'd say it's a pretty similar gambit, from that all the way to Texas. The rattlesnake vaccine, anywhere we have big, bad, gnarly rattlesnakes, it's something that could be considered, have a conversation with those, just kind of weighing the pros and cons, the risks and the benefits, and picking which one would be appropriate.
So I guess let's run through the other three. I know it's probably going to be pretty redundant considering the core vaccines, but all right. So what would you say would be important for, let's say, the Midwest? I think, is Texas part of the Midwest, or my geography is off?
Yeah, we're kind of south more so, but we'd be a pretty similar bracket. So again, distemper parvo, and to break it down even more, with a lot of our vaccines, there's other things that are kind of mixed in with it. So we have distemper parvo, and the abbreviation is DAPP or DHPP. People might notice that. So the distemper, and then one of the P's is parvo. We then have parainfluenza, which is an interesting one. So parainfluenza is actually not one that's horribly devastating, but it's actually part of the complex of kennel cough. It's also one that has been shown to not last quite as long as some of the other letters that we're describing in this vaccine. And then we also have adenovirus, which is canine hepatitis. So we kind of lump that in and just abbreviate it as distemper parvo or DAPP. So all of those I would recommend for our Midwest, South, West Coast. And then, lepto would still be prevalent. And in a lot of cases, we can mix the lepto in with distemper parvo. So they're getting one shot. I wouldn't call it one vaccine, but they're getting one shot with that combination protection.
Okay. And then what about, I guess, would you say for the Northeast, what vaccines would you say are important?
So Northeast, all of those listed above, but that's where Lyme starts coming into play. And again, Midwest, again, consulting with your local veterinarian. I mean, everybody's familiar with their region, and having, a bunch of animals come in. We know what's in the area. So Lyme disease is the East Coast is a poster child for Lyme disease. So.
Got it. Okay. So, all right. So how do animals or pets indoor and outdoor frequency change what vaccines you would recommend? I know you said it based off lifestyle. I think, we already touched on it a little bit, but why don't you expand on that?
Yeah. So again, if you have a pet that is indoor only for the most part, goes out into a very controlled environment, has no risk of coming into contact with any wildlife or standing water, anything like that, we can probably forego doing something like lepto or Lyme disease or Lyme vaccines. Same thing for Bordetella. The one thing with Bordetella is, if you have big gaps in your fence and your pet never leaves your yard, but you have an adjoining fence with another dog that you don't know the vaccine status of, even though it's the layman's term is kennel cough vaccine, if you have a dog that has Bordetella on the other side of the fence, that's possible transmission. So those are all things we kind of take into consideration. But again, if you have a dog that just goes with you absolutely everywhere, and that's built into your routine is going to the dog park, then we're going to need a little bit more protection for those guys.
Got it. Okay. Now let's move on to the fun part of the conversation. Vaccination is extremely important. But now I guess we're starting to see some more publicity on this, but there's this thing called over-vaccination. As from a vet's perspective, can you tell me a little bit about what over-vaccination is? Is that a thing?
Yeah, this is the nitty gritty, and this is where both in the public and as well as the veterinary industry in some regards, I mean, we're for the most part pretty united, but we still have a few little outliers that, the gloves just start coming off when you talk about what's appropriate, what's not. But, unfortunately, as I mentioned before, with some of the limited research we've been able to do, veterinarians back in the day would just get into the routine of, okay, every year you need these vaccines. Just if, lifestyle, we'll take it into consideration. But, some of these vaccines, even like parvovirus, at one point in time, we were recommending vaccinating for that twice a year. There's some, and it's not just from a veterinary standpoint, there are some boarding facilities, even to this day, that say, we will only accept dogs that have been vaccinated for Bordetella, every 6 months, which research now shows is completely inappropriate. It's a solid year of protection. So, as time has gone on and we've understood these vaccines a little bit more, and we've now waded into what we call titer testing, looking into serology to really say, okay, how long are these vaccines actually good for? And, it's still fairly limited population. And the caveat is, well, let me back up. So the more research that we do, the more we're starting to see that vaccines actually will last quite a bit longer than what we originally thought. And so the paradigm shifting, what we used to recommend every single year, we now recommend no sooner than 3 years, with the exception of those bacterial vaccines that we know we lose protection in a year, no matter what. And so, over-vaccination, we're starting to shift away from over-vaccination. But it's still finding that happy medium of, okay, we don't want to over-vaccinate, but we also don't want to just assume that every dog's immune system is created equal, and then possibly have a few of these kiddos falling through the gaps and potentially be at risk of contracting some of these pretty nasty diseases. And one good example that I had, so as a veterinarian, we're required to be vaccinated for rabies, just like our patients. So, and what we do in people is every 2 years, we check our titers. There's really not any one set, this is our vaccine protocol. It's, you get your initial series, and then you get your titers tested every 2 years. And if those titer tests come back to say your immune system is no longer protecting you from rabies, that's when you get revaccinated. And for one example, I've been vaccinated for rabies twice ever in my career. And, my titers just consistently said, you're good, you're good, you're good. And then one of my very good friends in vet school, the first time he had his titers taken, it showed he wasn't being protected. So he had to get revaccinated much earlier than I did in my career. So, the same thing's happening in other species as well. Unfortunately, that titer testing, it's still pretty expensive. So when given an owner the opportunity, hey, do you want to spend a couple $100 on titer testing to see if your dog's protected, and then if they're not, still get revaccinated, or do you want to just get this vaccine and call it good? And for, a lot of people will say, yeah, I'll just get the vaccine because that's what I've been doing for years. But I do feel as the years go on and titer testing becomes more available, it becomes more commonplace, and people understand it more. This over-vaccination conversation is going to be less of a hot topic, or a spicy topic, I should say.
Got it. Okay. So, real quick, just in layman's terms, can you what is titer testing for those who don't know what titer testing? To me, it sounds like just getting your blood work drawn, or getting some blood drawn and just having it spun around and tested.
Exactly. That's actually, so it is a blood test. So we look at the blood and the antibodies that are in your body. And that's a whole rabbit hole of discussion in and of itself. We have a whole smattering of different types of antibodies that do different jobs, but we can look at one specifically that will give us an indication. We'll get kind of a number, so to speak. And once we have that number, we can compare it to other animals that have the numbers and say, kind of qualitatively, are you protected? Are you not protected? So that's essentially what titers are.
Got it. Okay. And I was going to ask this question, but maybe you can expand on it a little more, kind of take what I'm going to ask you and just kind of reiterate, maybe take it another step further. So why, you said we're the paradigm is shifting, but still, I think over-vaccination is happening. And I mean, I guess you can't really speak for all veterinarians, but why would you say over-vaccination is happening, even if we're kind of realizing that some of these vaccines are redundant, and or at least not necessary as early as like annually?
Yeah. So I think it's just, and I hate to throw anybody under the bus here, but, if you go into kind of an old school vet clinic, that they've been doing it the same darn way, since like 1979, And that's just how they know to do it. And then chances are they're still going to be recommending vaccinating every year, even though we are seeing that these vaccines are protecting for a whole lot longer, and not, instead of really taking a step back and saying, oh, okay, well, let's meet in the middle. It's, this is how we've been doing it. This is what my clients expect. And this is how I'm going to do it until the day I die.
Got it. Okay. So let's talk about some of the dangers of over-vaccination. Now, what can happen when a dog is over-vaccinated? What kind of reactions are we talking about here when when a dog has, been overly vaccinated?
So again, the jury's still out, but just some of the things that are of concern, it can cause different allergic conditions, different allergies to some things. Again, there's not been any definitive research to prove that. Certainly if it's not necessary, I think if you polled 20 vets and said, let's give this animal something that's not necessary, all 20 of them will say, no, we're not going to do that. If we have an animal that, say, came into a shelter, we have no idea what that vaccine status was of that pet, and we don't have the funds to run titer testing, we're going to go ahead and vaccinate that pet. And, even if they had been vaccinated 3 days before, the chance of a reaction is very, very low at the end of the day. I think there's this big scary picture of, animals getting vaccinated for something and then having an anaphylactic reaction, collapsing, vomiting, diarrhea. There's some scary conditions like immune mediated hemolytic anemia. But at the end of the day, those reactions are very, very uncommon. And because they're so uncommon, the risk of just covering your bases and that animal having a reaction is so low, but the benefit of making sure that animal is protected, it's a bit of a no-brainer. But most of the reactions that we see from vaccines are things like regional pain. So same thing when we go and get a flu shot or a COVID vaccine, you feel like you got slugged in the arm for a couple of days. And the difference, we're a little bit worse because we get IM vaccines. Animals get sub-Q vaccines that are typically a lot less uncomfortable. But same thing, we can still get regional pain. Sometimes we can have them a couple of days of volume turned down, just feeling a little punky. Same thing happens in people. Vomiting, diarrhea, and then we can progress to having anaphylactic. But I will say in my career, since getting this whole party started back in 2014, I can count on one hand how many dogs I've had have any variable spectrum, of any reaction on that spectrum. So it is pretty uncommon.
Got it. Okay. And when you see these adverse reactions, what do you think it causes? Why do you think it causes it to happen? Is it the vaccine itself? Is it that combined with, I guess, the genetic DNA of the dog, or maybe their environmental factors that they've already kind of had some exposure and they're already weakened? And I don't know. Tell me, what do you think?
Connor, that's a great question. And I don't think we know the exact answer, but it's likely a genetic difference in their immune system. And that's what we're trying to do with our vaccines, is we're literally trying to coach the immune system to be more robust and protect in the event that we're exposed to this. And, vaccine doesn't necessarily mean that animal's never going to get that condition, but it means that if they do, it's going to be a whole lot less devastating than if they didn't have the vaccine. So that's some misunderstanding. But in those rare instances where, just like, some people are allergic to bee stings, and if they get stung by a bee, their throat swells shut and their face swells up, or if somebody eats a peanut, same thing. So, and you don't ever really know if you're allergic or going to have a reaction to something until you're vaccinated for it. And sometimes by priming the immune system, it can go haywire. And then the next
Mhm.
time exposed to it can have a reaction. So if I had to simplify it, grossly simplify it, I would say it's similar to an allergic reaction.
Got it. Okay. Well, it's interesting that you bring up people who are allergic to peanuts. I don't know if this is um, true or not. I thought I'd heard this from a neurobiologist. He has a podcast. His name is Andrew Huberman. Not sure if you're familiar with him, but he was talking about how people can. There's some recent, very recent. So if you're allergic to peanuts and you're listening, don't crucify me because I'm sure you wouldn't want to go through this. But by continuously exposing the person to the thing that causes the anaphylactic shock, that someone was able to get them to not basically have that huge reaction to where they could die.
Yeah, no, and that's a thing. I mean, that's an extreme example that has pretty bad repercussions, if it goes sideways. But
Yeah.
we do the same thing in animals, and so it's a slightly different type of vaccine. It's called immunotherapy. So if we
Mhm.
have an animal that has allergies, we can do a blood test and see what kind of environmental allergies they have.
Yep.
And so if you have a dog that's just so itchy and they're itchy all the time and it's really worse in the spring and in the fall, we can actually run a blood panel, see how reactive they are in their body to those certain things, and then make a little cocktail of either a sublingual drop or an injection that has incrementally, just like you said, teeny, 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 tiny amounts of that allergen. And then
Mhm.
gradually over the course of a year and a half, 2 years, ramp that up to the point where they're either not reactive or less reactive.
Mhm.
So that's, similar to, or is a vaccine, just a little bit different way to look at it.
Yeah. So, and obviously with the consent of the pet owner, I'm assuming too, right?
Oh yeah, for
Yeah. Yeah.
sure. I mean, it's a whole song and dance,
Mhm.
but it is effective, but it takes a long time.
Yeah, that's really cool. I mean, I'm excited to see where that goes for those who are allergic to shellfish because I mean, me and my girlfriend, we love seafood. We're getting off on a tangent and then I'll get back to this next question. But um my buddy's allergic to shellfish, so we can't ever, like, whenever they come over to when we want to cook for them, we can't ever do that. So that would be pretty interesting if there's some breakthrough farther down the road. Okay. So can a dog, so if let's say a dog has a severe reaction to a vaccine, um I don't know if you've seen one, but is it possible that that dog can recover completely and be totally normal, or are they, when they have that severe adverse reaction, is it affecting them and their quality of life for the extended, I guess, duration?
Yeah. So as far as I know, I'm sure, there's always the extraneous cases, but I've not personally ever had a patient die. Everybody
Hmm.
hates to think about that, but any patient that I've had that had a vaccine reaction did recover fully.
Mm,
There was one who needed some supportive care. He needed to hang out in the hospital for a few days, but made a full recovery, and it wasn't an issue long term.
okay.
Mm-hmm.
All right. Well, I just wanted to know. So I had something written down here. I did some research and found some vaccines. I don't know if this is subjective information, but um, these vaccines that they provide immunity for years and even lifetime immunity. I believe I shared them with you. I'll when this rolls, I'll when this podcast comes out, I'll have it displayed here on the screen. But there's a little chart here, a little like list that's saying here's the minimum duration of common vaccines. And the word challenge means the researchers exposed the animal to the disease, and serology means they measured blood antibody levels Could you explain that little where it says distemper 7 years by challenge, and then there's a slash 15 years by serology? Because I mean, it's pretty much what it looks like throughout the whole list. Like parvovirus is 7 years by challenge, 7 years by serology. So it seems like these vaccines are lasting, at least according to this specific article I pulled that said 7 years by challenge. Could you explain what that means?
Yeah, no, this is awesome. And I think a lot of, um, because this is a difficult thing to understand if you didn't spend 4 years in vet school and go through immunology and virology and all that good stuff. So 7 years by challenge, that means that one, two, hopefully a very small population of animals were given this vaccine. And 7 years after that, they were actually exposed. So we were rolling the dice as to whether or not we were going to give this subject, I hate to say that, but subject, whether they were going to contract full-blown distemper or parvo or adenovirus or rabies, and whether or not they were going to be protected or not. So serology is a little bit safer to and more humane to test for, because again, it's just a blood test. The problem with serology is we don't always know at what cutoff do we get protection, because you have to challenge it. That's the only way to know if an animal is truly, truly protected, is by challenging it with the virus or with the bacteria or whatever it is that you're vaccinating against. So we have these numbers, and they're very encouraging numbers. I'm not poo-pooing on the study. I'm very excited about it, but it has to be taken with a grain of salt that these are very small numbers of animals. And by taking that and then putting it to every pet in the US or any other developed country is a little bit risky, because the jury's still out. So we have to meet somewhere in the middle, and tread with caution as we start gathering this data to tell us, at what level does this serology or these titers actually equate to that pet being protected. And we can see, like we mentioned, the paradigm shift, where we used to vaccinate twice a year and then once a year, and now we're seeing no sooner than 3 years in a lot of our core vaccines. I suspect, as we get more data, that number is probably going to keep going up, but we can't just jump to conclusions that may not be true. Going back to, my friend who was vaccinated for rabies and became, potentially at risk at 2 years. And then I, was on the marathon and didn't need to get vaccinated until many years after that.
Got it. Okay. Yeah, I think it's interesting. I believe my dog even got vaccinated here recently in the past couple months. The only reason I don't know is because I kind of scanned the receipt and I wasn't sure. I mean, I thought it was just an annual checkup, so I wasn't expecting her to get vaccinated. But my dad ended up taking my dog, and I think she got the Bordetella vaccine, which is weird because we never. I mean, to be fair, whenever we go on a trip, we're always able to find friends that are able to, watch our dogs. So, I mean, you were telling me that Bordetella is a vaccine that's mainly for dog boarding and if they're going to be, around dogs. Is that correct?
That's, typically, or if they have nose-to-nose contact with dogs that we don't really know what their vaccine status is or what their lifestyle is.
Got it. I mean, I guess you could argue. I mean, my neighborhood, pretty much all of them, not all of them, but a lot of them have dogs. I'd probably say 90 to 95% of them. So I guess that would make sense. I don't know if she had that. I'll have to look, but I thought that was interesting, and I wanted to bring that up just because I had a personal experience where they gave her a vaccine, and I probably, if I was there, I would have been like, yeah, sure, But now with this new research and this new information, I would probably at least get more clarity before I decided that, yeah, sure, let's get the Bordetella vaccine.
Yeah.
Go ahead. What were you going to say?
Well, and a good example of that, again, just having a candid conversation with your vet or their technician, explaining all the details. So, for instance, I have a patient that I've been taking care of for 5 years, and he's a
Mm-hmm.
super cool little dog, but he has what's called Addison's disease,
Mm-hmm.
where he's very, very susceptible to stress. So, he has a very controlled lifestyle. He doesn't board, he doesn't go to dog parks, he just hangs out in his little domain. But the owners decided they were going to adopt another dog and a much younger dog. And she goes out to dog parks. She goes to doggy daycare. She's in training every day. So his perfect little bubble has now shifted. And
Mm-hmm.
so, we just were kind of going through the motions, looking at the record, and they brought that up. And it was, oh, no, 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 he doesn't need that. I said, well, wait a second, things have changed, and he now has this risk of exposure. So maybe we should take a step back and reconsider this.
Mm-hmm.
So that's just one example
Mm-hmm.
of custom tailoring to that lifestyle.
Interesting. I never really even thought about that. I mean, fortunately, so my girlfriend just moved in with me, and she has a 17-year-old dachshund. I mean, he's not really, I, he's one of those ones where I think as they get older, they get a little more, less patient with puppies.
Oh yeah.
Yeah. So
Just crotchety little old men.
yeah. That's exactly what's going on at my house. I get to watch it every day. So I don't think, I'm fortunately not at risk, but I could see where that would make sense to get the Bordetella if like I got a new dog, which I try to slowly massage that idea into my girlfriend's brain. Maybe, we should get another one. But okay, so I've heard this, and I want to hear your thoughts or your perspective as objectively as possible. I heard this thing that there's some vaccines that can cause cancer. Is that true? And if they are they still, is that like one-off? Is that like anecdotal, or is that what's going on there?
Yeah, so I think that conversation's a little bit more relevant in the cat field. So,
Okay.
and it is a very fascinating one, and it is one that has vastly improved as we've come to understand these vaccines and what we're doing with them over the years. But in cats, they have a very unique immune system, and they can develop what are called vaccine associated sarcomas.
Mm.
And back in the day, we used to vaccinate cats, and especially, old timers, you grab them by the scruff and right in between the shoulder blades, and you'd
Mm-hmm.
be, good to go. See you next
Yep.
year. So we were using the exact same vaccines for dogs, cats, didn't matter. And then we started to see a few years after that we had a lot of cats developing tumors between their shoulder blades. And as we did more research, and a sarcoma is a type of cancer that can be managed,
Mm-hmm.
but it has to be removed, and it has to be removed with very wide margins. So if we had a tumor in between the shoulder blades, it's pretty hard to take, half the shoulder blades in the rib cage. Like, you're not going to have a cat left. So, vaccine associated sarcomas, they do exist, but they're much, much less prevalent because our feline vaccines are specific to felines, and they
Mm-hmm.
are what we call non-adjuvanted. And an adjuvant is something we add to a vaccine to actually increase the reaction that the body has to have a longer duration of effect. And so there's nothing, I'm not saying adjuvants are evil, but there's just something about adjuvants in cats that creates this very unique local inflammatory pattern that can potentially cause tumors years down the road. So what we've done is we've completely reworked these vaccines and made them very specific for cats. We are very particular about lifestyle vaccines and what we vaccinate for in cats. And we also vaccinate in the skin on the very lowest part of the leg that you can get. So in the less likely event your cat does develop a sarcoma, if cats are not four-legged, they are three-legged with a spare. So if you have a cat that develops a tumor on its leg, you can amputate the leg and the cat still has a wonderful quality of life, is cured of the disease, and we go on about our day, versus the tumor being in between the shoulder blades. So that's the big one. We actually have a vaccine that can help treat cancer. So there's actually a melanoma vaccine for dogs that if they do develop melanoma. So, you know, for one tick in the creating cancer bucket, I'm also going to just plug, there's one for the anti-cancer bucket.
Oh,
so
that's awesome. We need one for humans for sure.
Yeah. And I think, it was extrapolated from humans.
Oh, wow. I had no idea. That's amazing. Well, this has been a very informative conversation. Dr. Kingsley, thank you so much for coming on and talking about this topic, especially in today's age. It's definitely one of those confusing ones, especially, you know, with our pets, because it's just constantly changing, like you said. To wrap up, why don't you tell everyone where we can find you on social media and where we can find BetterVet?
Yeah, so BetterVet, you can download our app, which is super cool. It's very robust. You can add each one of your pets. You can make an appointment. If we're not in your area already, we will be soon. If you're not sure, you can, if you're a little hesitant about downloading the app, you can go to our website, which is www.bettervet.com, or find us on social with just BetterVet. If you want to see a lot of mountain bikes and cute dogs, you can find me at motodoc_46.
Awesome. And then to wrap up, why don't you, I think I touched on it on our last episode about BetterVet. Go ahead and for those who have not heard of BetterVet or what BetterVet does, why don't you go ahead and tell them what BetterVet is, their service, and how that's going to change the landscape for veterinary service.
Absolutely. So BetterVet is a full service nationwide house call practice. So we bring the vet to you and to your pets in the convenience and the comfort of their home. We're in, I believe, 20 cities nationwide. So keep your eye out if we're not there. If you've never tried a house call visit for your pet, you know, even if whether they like the vet or they don't like the vet, it really is a pretty big game changer as far as providing gold standard care and preventative medicine to your pet, and without having to stress them out and drag them into a waiting room, do the whole car ride, all that good stuff. So
awesome. Well, thanks again, Dr. Kingsley, for coming on. I had an awesome time speaking with you. All right, everyone, thank you for joining us today. Also, be sure to check out our website, topdogtips.com. We also have a YouTube channel, as you know. Subscribe to our YouTube channel, like this video. And with that, I hope you all have a great day, and we'll talk to you soon.